The plague, a devastating occurrence that appears frequently when we look back on human history. There was the Italian plague in 1629 that killed over 280,000 people. Various outbreaks of cholera in Africa killed thousands. European invaders were fond of spreading diseases to Native Americans, killing them by the millions and displacing many. Yellow fever and smallpox killed over thousands throughout Europe before proper vaccination was introduced. And of course, the most devastating outbreak of all, the bubonic plague. It infamously killed 200 million people in Europe, Africa, and Asia. In the age of vaccination, plagues that cull entire populations have become less common, but carelessness has brought us an outbreak, COVID-19.
I believe that Kenya is strategically positioned to serve as a medical tourism hub for our sub-region. Indeed, our own private hospitals have been attending to patients from Uganda, Rwanda, Burundi, Nigeria, and Kenya remains a pioneer, both by way of policy and by the advancement in medical technologies. And now, more than ever, I believe we must converge as stakeholders to see how we can improve the quality of our healthcare.
COVID-19. This disease has caused a global shutdown of travel and industry. It has infected millions and killed tens of thousands of people worldwide. It's safe to say that the world has not been disrupted like this since World War II. Compared to other countries, Kenya has it easier. We have over 100 cases and 4 deaths. Most public institutions have closed and people now work and study from home. Streets are empty and roads have low traffic. Our biggest concern, aside from hysteria and overreactions, is our economy. Businesses have taken measures to stop the spread of the virus, such as restaurants only allowing takeout, having sanitizers at the ready and reminding visitors to keep spaced. These measures are important and seem to be enforced everywhere. With that said, stores are still open and stacked with goods. Beyond the economy, there has an unacceptable rise in police brutality when enforcing curfew laws. This has drawn attention to the lack of restraints shown by the Kenyan police and their hopes to see this behavior punished accordingly. There isn't much that Kenyan can do for its economy in this scenario. Stopping the spread of the disease takes priority. How to restore the economy to a better state will have to be discussed after this outbreak ends and it's safe for us to return to work. How far COVID-19 goes and if we can survive against it remains to be seen. It seems we all have just to brace for the storm.
Furthermore, investments in the health sector must also be complemented with cross-sectoral investments in education, nutrition, hygiene, social protection, which yield compounding benefits on healthy societies. I therefore call on all the non-state actors, our private sector, including medical service providers, insurance companies, and financing institutions, to join hands with us in pooling of resources that will extend the reach of quality medical services across our country. And this is a lever that increases efficiency of the resource application in the health sector, while also ensuring that quality healthcare is not just a privilege of just a select few, but one that ensures that the most vulnerable in our society are also effectively protected.